So now when we start to talk about the actual surgery itself, the first step that I would definitely say is essential is really to look in the joint. I do sometimes hear that there are surgeons out there that are doing stifle surgery for cruciate disease without looking in the joint, either via arthrotomy or arthroscopy. And I do feel that this is really an essential part of the successful management of these patients. One, I do like to always confirm, do I truly have a cranial cruciate ligament tear? Because occasionally I may actually have a caudal cruciate tear and it's not a cranial cruciate tear. I also like to confirm how much of that cranial cruciate ligament is torn. What is the rest of the joint looking like in terms of secondary osteoarthritis? But probably the most important piece is to evaluate and treat secondary meniscal injury. We know that at the time of surgery, the percentage of dogs that have got secondary meniscal injury is super high. In some historic papers, it's almost as high as 90% of cases will have secondary meniscal injury. In my mind, if we're not taking care of that meniscal injury, this is a good chance that this dog will not resolve its lameness, despite, how fabulous that XCAP procedure is. So this was actually a pretty useful paper that's now from a little bit ago, but they took a bunch of dogs that all had all had cranial cruciate ligament injury. They took them to surgery. They all happened to have meniscal injury as a secondary finding. So they took them to surgery, took care of that meniscal injury with either a partial or a hemi-meniscectomy. And then in half the dogs, they ended up doing extracapsular stabilization. And in the other half of the dogs, they actually did not do any other type of stabilization. And then they followed them out. And I think the median follow-up time was between 1 year and 2 years for most cases. And they found that in this post-operative time frame, that they actually did not see a clinical difference or owner-assessed difference in these two groups of dogs. So what does that tell us? It tells us that likely in at least this small population of cases, that the meniscectomy happened to be the most important piece for their successful recovery versus whether or not they were stabilized with an extracapsular suture. What was a little tough to tease out from this paper was chronicity. My guess would be because all these dogs did have secondary meniscal injury, probably was a population of dog that had a little bit more chronicity to their cruciate disease, probably weren't highly unstable would be my other bet, which is why probably the two groups ended up performing pretty similarly.